Measles is back. This highly contagious virus, which was declared eliminated in the United States in the year 2000, has made a troubling return. The resurgence of this disease is alarming health officials and the public alike. This highly contagious disease was once considered eliminated in the United States. The success of vaccination programs had led to a dramatic decline in cases, making measles a rare occurrence. However, the recent outbreak in Texas has shattered this sense of security. Now, a significant outbreak in Texas has brought measles back into the spotlight. The state, known for its vast landscapes and bustling cities, is now grappling with a public health crisis that many thought was a thing of the past. This outbreak is a stark reminder of the importance of vaccination. Vaccines are one of the most effective tools we have to prevent the spread of infectious diseases. They not only protect those who receive them, but also help to safeguard the broader community by achieving herd immunity. As of March 1, 2025, Texas has reported 146 confirmed cases of measles. This number is particularly concerning given the rapid spread of the disease and the potential for further transmission. This is the worst outbreak in the state in nearly 3 decades. The last time Texas faced such a severe measles crisis was in the early 1990s, a period that saw significant public health challenges. The outbreak began in late January 2025. Initial cases were reported in several communities, and despite efforts to contain the virus, it quickly spread. It has spread to several counties including Gaines, Lynn, Terry, and Yoakum. These areas have seen a surge in cases, prompting local health authorities to take urgent action. This outbreak is particularly concerning because it has resulted in severe illness. Many of those affected have experienced serious complications, requiring intensive medical care. At least 20 people have been hospitalized. The strain on healthcare facilities is growing, and medical professionals are working tirelessly to manage the influx of patients. One unvaccinated school-age child has died. This tragic loss underscores the deadly potential of measles, particularly for those who are unprotected by vaccination. This is a tragic reminder of the potential consequences of this serious disease. Communities are coming together to mourn and to support one another during this difficult time. The epicenter of the outbreak is Gaines County. This area has been hit hardest, with the highest number of reported cases and the most severe impact on local health services. This county has a high rate of vaccine exemptions. The decision by some parents to forego vaccinating their children has contributed to the vulnerability of the community to this outbreak. This highlights the role of vaccination in preventing the spread of measles. Vaccines are crucial in maintaining public health and preventing outbreaks of diseases that can have devastating consequences. The majority of measles cases in Texas are in children. This is particularly concerning because children are among the most vulnerable to the severe complications of measles, which can include pneumonia, encephalitis, and even death. Out of the 146 cases, 116 are in children aged 17 and under. This statistic highlights the critical need for effective vaccination programs targeting young populations. This is a vulnerable population that relies on vaccination for protection. Without adequate immunization, children are left defenseless against this highly contagious virus. Vaccination status is a key factor in this outbreak. Ensuring that children receive their measles, mumps, and rubella (MMR) vaccine on schedule is crucial in preventing the spread of the disease. A significant number of those infected were unvaccinated. This underscores the importance of maintaining high vaccination coverage to achieve herd immunity. 79 individuals had no record of vaccination. This lack of documentation makes it difficult to track and control the spread of the virus. For 62 individuals, the vaccination status is unknown. This uncertainty further complicates efforts to manage the outbreak and protect the community. This underscores the importance of vaccination in preventing measles. Public health campaigns and community outreach are essential in educating parents about the benefits and safety of vaccines. The outbreak is primarily impacting a close-knit Mennonite community. This group has unique cultural and social dynamics that can influence health behaviors, including vaccination. This community has a lower vaccination rate than the general population. Addressing the specific concerns and barriers to vaccination within this community is vital. This highlights the need to address vaccine hesitancy within specific communities. Tailored communication strategies and trust-building measures can help improve vaccination rates. This outbreak is a reminder that measles is highly contagious. The virus can linger in the air for up to 2 hours after an infected person has left the area. It can spread quickly in communities with low vaccination rates. This rapid transmission can lead to widespread outbreaks, putting many at risk. This puts everyone at risk, including those who are too young to be vaccinated or have medical conditions that prevent vaccination. Protecting these vulnerable individuals relies on the immunity of the community as a whole. The MMR vaccine is a safe and effective way to protect against measles. MMR stands for measles, mumps, and rubella. These are 3 serious diseases that can have long-term health consequences. The MMR vaccine works by introducing a weakened form of the measles virus into the body. This triggers the immune system to produce antibodies against the virus. These antibodies provide long-lasting protection against measles. The MMR vaccine is highly effective. 2 doses of the vaccine are 97% effective at preventing measles. This makes it one of the most effective vaccines available. Vaccination not only protects individuals but also helps to protect the community. When a high percentage of the population is vaccinated, it creates something called herd immunity. Herd immunity occurs when a large portion of a population is immune to a disease. This makes it difficult for the disease to spread. This is especially important for those who cannot be vaccinated. This includes infants, pregnant women, and people with weakened immune systems. The threshold for herd immunity varies depending on the disease. For measles, it is estimated to be around 95%. This means that 95% of the population needs to be immune to prevent outbreaks. Unfortunately, vaccination rates have been declining in recent years. This is due in part to the spread of misinformation about vaccines. This is a dangerous trend that threatens to erode herd immunity and leave communities vulnerable to outbreaks like the one we are seeing in Texas. Section 5. The measles virus, highly contagious and potentially deadly. Measles is a highly contagious virus that can spread through the air. It is so infectious that if one person has it, up to 90% of the people close to that person who are not immune will also become infected. It can live in the air for up to 2 hours after an infected person has left the room. This means that even after the person has gone, the virus can still be inhaled by others who enter the space. This makes it easy to spread in crowded places such as schools, daycare centers, and airplanes. These environments are particularly vulnerable because of the close contact and shared airspace. Symptoms of measles typically appear 7 to 14 days after exposure. During this incubation period, the virus is multiplying in the body, often without the person knowing they are infected. They include fever, cough, runny nose, red and watery eyes, and a rash. These symptoms can be mistaken for other illnesses, making early detection challenging. The rash usually starts on the face and spreads to the rest of the body. It is a telltale sign of measles and can help in diagnosing the disease. Measles can be serious, especially for young children. Their immune systems are not fully developed, making them more susceptible to severe complications. Complications can include ear infections, pneumonia, encephalitis, which is swelling of the brain, and death. These complications can lead to long-term health issues or even be fatal. In fact, measles is one of the leading causes of death in young children worldwide. Despite the availability of a safe and effective vaccine, measles continues to pose a significant health threat, particularly in areas with low vaccination rates. Section 6. The public health response, containing the outbreak. Health authorities in Texas are working hard to contain the outbreak. The Texas Department of State Health Services, or DSHS, is collaborating with local officials to track cases, identify contacts, and provide vaccinations. The Centers for Disease Control and Prevention, the CDC, is also providing assistance. The CDC is offering technical support, laboratory testing, and vaccines to help with the outbreak response. One of the key strategies for controlling the outbreak is vaccination. Health officials are urging anyone who is not vaccinated to get vaccinated as soon as possible. They are also recommending that people who have been exposed to measles get vaccinated or receive immunoglobulin treatment. Section 7. Measles in the U.S. A growing concern. The measles outbreak in Texas is part of a concerning trend. Measles cases are on the rise in the United States. In 2024, there were 285 measles cases reported across 33 states. This is a significant increase from previous years. There have been other notable outbreaks in the U.S. in recent years. In 2024, there was a large outbreak in Chicago with over 60 cases. This highlights the vulnerability of communities with low vaccination rates. The decline in vaccination rates is a major contributing factor to the resurgence of measles. This is a serious public health concern that needs to be addressed. Section 8. The importance of vaccination, a call to action. Vaccines are one of the greatest public health achievements of all time. They have saved millions of lives and prevented countless cases of disease. The MMR vaccine is a safe and effective way to protect against measles, mumps, and rubella. It is important for everyone to get vaccinated according to the recommended schedule. This helps to protect individuals and communities from vaccine-preventable diseases like measles. Talk to your doctor if you have any questions or concerns about vaccines. We all have a role to play in preventing the spread of measles and other vaccine-preventable diseases. By getting vaccinated, we can protect ourselves, our families, and our communities. Section 9. Conclusion. Protecting our communities from measles. The measles outbreak in Texas is a stark reminder of the importance of vaccination. Measles is a highly contagious and potentially deadly disease. Vaccination is the best way to protect ourselves and our communities from measles. We need to work together to increase vaccination rates and prevent future outbreaks. This includes addressing vaccine hesitancy, ensuring access to vaccines, and promoting accurate information about vaccines. By working together, we can create a world where everyone is protected from measles and other vaccine-preventable diseases.